Over to you, Dr. Samir. Thank you.
124, 124. सुन रहा है पीछे?
Hello, 1, 2, 3, 4.
So this is me. I won't waste much of your time. So I have done BDS in 2007. I also got trained in medical ozone therapy. I am also a body pain specialist in my region. I mainly work on occlusion, and I also do pinhole implantology. So guys, if you are looking for a dentist as a superhero, your wait is over now. I am in front of you. So I would like everyone to be very attentive, क्योंकि last में I will be asking you few questions. जो भी questions का आंसर देगा उसको फ्री गिफ्ट मिलेगा कल. So I won't waste much time in these slides. I think everyone knows about the actions of ozone, but I did a lot of hard work while preparing this presentation, but I made it on Canva, but it didn't work over here. So ozone also helps to remineralize the tooth structure. It also helps to absorb more of the calcium and phosphorus ions. And in my clinic, I would only tell about the practical things that I generally do in my clinical practice. So ozone administration, basically I use 4 things in dentistry. One is direct ozone gas, ozonated saline or ozonated water, ozonated oils I use in routine, and ozone injections as well. So I will start with the clinical applications of ozone in dentistry. So in this way we ozonate water for the patient for rinsing. Whenever the patient comes to our clinic, we always ask the patient to rinse with ozonated water. And we also use this water in my dental chair, where this ozonated water is being used in every procedure. Sorry. Before sterilization, after washing my instruments, I always ozonate the instruments, so that after that, only after that I keep the instruments for sterilization. So I think सबसे पहले जो आप अगर डेंटल के बारे में सोचो तो सबसे पहले दिमाग में क्या बात आएगी कि दांत में कीड़ा लगा है. That is basically caries. So ozone also helps in remineralization of the incipient caries. So this is a pit. I'll show you a video after some time. So a pit starts with caries start with a small pit, and the bacteria invades the structure, and they go to the root canals. From the root canals they go to your bone. So this is the way when here the infection goes to your bone and the tooth is considered non-vital. Generally I don't do root canals now, but yes, earlier I used to do root canals, and in the starting only when I started using ozone therapy, then I used to disinfect my root canals with ozone. So this is a pit. This pit has not invaded the surrounding structures since 1 year. I am doing ozone insufflation on this pit. Also I have given ozonated oil to the patient to brush daily with that ozonated oil. So this caries has not increased. So in restoration, while doing the filling, basically what I do is I always ozonate the tooth structure before removing the caries. Also after removing the caries, before putting the restoration back, I always give ozone insufflation and wash it with ozonated saline. So after extraction I vigorously irrigate it with ozonated saline and then directly pass ozonated gas into the extraction socket. So in my general practice, my patients don't take much of the medications. They just take 1 2 painkillers, that 2 SOS. After ozone gas insufflation, I again give ozonated saline, wash it with ozonated saline, and I give ozonated oil to the patient to use it daily, frequently, every day. And I also, if the patient is ready, I call the patient for 5 days, and the patient is always pain free. They don't take any medications if they are coming to me for 5 days after extraction. So dry socket is a very painful condition. After extraction, if your socket is not healed properly, your blood clot is disintegrated due to any reason, you will feel severe pain because the bone is directly exposed to the oral environment. So this is the way I do ozone insufflation and put ozonated oil in that, and I give ozonated oil to my patient to apply on the dry socket and around that surface area frequently, almost 5 to 7 times in a day. So this heals very beautifully. Now OFI also they have come with the healthy teeth oil, and that would happy teeth, sorry, that would be very game changer in every dentist day-to-day life.
We have to do something.
Yeah. So in root canal treatments, generally I don't do root canals now. I do pulpotomy instead of pulpectomy. That is a procedure I think dentists can understand better. I just seal the nerves in the pulp only. I don't do root canals. So, but this is a video I made for a patient. This is a referred patient for re-RCT. So first of all, I irrigate it with ozonated saline, then give ozonated gas, then again give ozonated saline and pack it with ozonated oil. This really heals the socket the pathology very easily. So this is the oil. My colleague who uses ozonated oil as a lubricant for files, she made a video for me because I don't do root canals now. So this helps to, yes, basically what we do is we just put the oil on the glass slab, wet the file with the oil, then do the BMP, the root canal procedure. So role in prosthodontics in my clinic, what we do is before putting the crowns, because everyone must be having 1 or 2 crowns in their mouth, before putting the crown, we ozonate that crown, and I also ozonate the tooth structure before bonding, before final cementation. Either this way or the other way, I dip it in the water and ozonate the processes before the final cementation. I also ozonate all the tooth structure before putting the cementation of the crown processes.
This is flushing with ozonated saline.
Flushing with ozonated saline so that the tooth structure may not get dehydrated. It helps in infections, avulsed teeth. It gave me very good results in 3 of my patients who got removed their tooth, and I just, what my protocol is, I basically irrigate the avulsed tooth with ozonated distilled water for 2 minutes, and also ozonate that socket also, and it has given me very good results. This patient came to me 5 days consecutively for ozone therapy, and he was almost pain free. It also ozone helps in hypersensitivity, like अब आपके दांत में कीड़ा नहीं है, then even then you feel sensitivity like to hot or sweet. So ozone helps in desensitizing that area also. But the thing is, what I have understood in my practice, that hypersensitivity is always because of your malocclusion. When the forces on your teeth are not proper, only then you feel hypersensitivity. So I generally correct the occlusion, and the hypersensitivity is gone immediately. During implant placement, I basically do pinhole implantology. I don't use any blades or any stitches. I use highly ozonated saline during my procedures, and my patients, even after getting full jaw done, they just take 1 or 2 painkillers. No antibiotics, no painkillers, nothing. In periodontology means in your gums. So periodontology is related to many diseases in our body. So I use ozonated distilled water while doing the scaling, while cleaning your teeth. And after cleaning, I do ozonated gas insufflation. It helps to reduce the bacterial load inside the cavities. That is a major reason of, I think, the major reason of all the diseases in the body, like of your gut disease, your basically systemic diseases also. So this is, I think, many people must be looking for mercury fillings. I do have a full video for that on my YouTube channel. I remove the mercury filling in a very, means whatever I can do in that protocol. This is a basically I am removing the mercury with double high power suction, and I use ozonated distilled water, highly ozonated distilled water while doing the procedure, and I try to chunk it out rather than drilling it all out. And after removing that, I ozonated with, I flushed that area with ozonated saline. So here comes my favorite topic, temporomandibular joint disorder, TMJ. So TMJ is linked to many diseases in the body, means I am doing this TMJ treatment from 2016, and I have learnt a lot during these years. Just a video.
Hello, I'm Dr. Ramandeep, dentist by profession and a functional medicine health coach. For the past few years, I had been having a lot of attrition in my teeth, and because of that, there was a lot of stiffness around my TMJ joint, and especially when I got up in the morning. And it used to keep aggravating every day. So in the recent years, like let's say about 1.5 to 2 years back, my stiffness in my TMJ had increased a lot. So whenever I used to get up in the morning, it was difficult for me to open my mouth, and whenever I did my yawning, I used to have a TMJ lock. So that really troubled me. So last year in October, I met Dr. Samir and I consulted him regarding my stiffness and grinding of my teeth. And somebody had told me that he's an expert in treating TMJ diseases with ozone therapy. So when I talked to him and he got my x-rays and everything done, he gave me ozone injections on my TMJ and behind my ear, I think. And this treatment was done twice. And I could see a drastic change in my upper jaws, that I felt better, I felt relaxed, and I could chew my food very properly. Because I realized at that time that chewing my food was like gulping my food. Like I wasn't chewing my food, I was gulping my food. But after those injections of 2 sessions, I realized that I could chew my food better and my jaws were relaxed, especially in the morning. So then he gave me a device which I put at night, and it is placed on my upper interiors, that I place it at night. It's like a guard. And when I get up in the morning, I have no issues with my stiffness, and I sleep better, I breathe better. And I have realized that whenever there is a gap now, because I haven't taken those injections again, it has been about I think 3 months, that my chewing has again become an issue, that now I'm not chewing again properly the way I used to. So now I can relate between the difference between how it is when I have taken the injection and how it is if there is a long gap. So it has really made a difference, and I recommend that if anybody is having these issues regarding the TMJ which are going unnoticed, because nobody is going to tell you, even a normal dentist is not going to tell you. Me being a dentist did not notice these things. So this has really helped me. Dr. Samir has really helped me in this. I have continued my treatment. In fact, I have to further go in for my treatment. It's just been my negligence that I haven't done what he has told me to do, but I am definitely going to do again. So please, if anybody has these issues, I recommend contact him and get them treated, because it really makes a difference in your lifestyle. Because we don't know what we are facing, and suddenly when you get treated, you realize that there's a huge difference between swallowing your food and chewing your food. And my stiffness has really gone. It has reduced to about 20% now, and it has really helped me. So Dr. Samir, thank you so much for making me aware and treating me. Thank you.
Basically, she is also a dentist.
That's why she spoke so much.
Yes. But TMJ injection is not a solution. That was just to tell her what things are being basically due to her TMJ. So ultimately her teeth alignment, her jaw balancing has to be done to cure her permanently. So next video would be for a girl who was in 10th class when she came to me. She was about to give her final exams. So let's hear from her only.
मेरा नाम कश्यप है. मेरी प्रॉब्लम 2 years से है जॉ की, और पहले मुंह लॉक हो जाता था, लाइक ओपन वाइड में रह जाता था, तो पुश करके उसको वाइड ओपनिंग बंद कर देते थे. और उसके बाद अभी लाइक रिसेंट में मेरी दोबारा पेन हो रही है जॉ में, और अब वाइड ओपनिंग, माउथ ओपनिंग होती नहीं है. एंड अब यहाँ पे जॉ हेडेक और नेक पेन और शोल्डर पेन बहुत ज़्यादा इंक्रीज हो गई है, और राइट साइड पे सारी प्रॉब्लम है. वाइड ओपनिंग वो प्रॉपर रह जाती थी, और उसको भी पुश करके वो बैक प्रॉपर बंद करना पड़ता था. एंटीबायोटिक्स ली थी और मेडिसिन उनकी प्रिस्क्राइब ली थी, बट उससे लाइक ज़्यादा फर्क नहीं पड़ा. वन फिंगर
माउथ ओपनिंग वाज वन.
अपने मुंह में डाल के देखो, फिंगर दो जाती है कि नहीं? दो भी नहीं जा रही. फिंगर ओपनिंग. अभी हेड में भी पेन है कहीं पे इस वक्त प्रेजेंटली?
राइट साइड के हेड में कुछ डिजीनेस फील हो रहा है, राइट साइड पे पेन हो रही है, नेक पे, जॉ पे, ईयर पे सुन आवाज आ रही है.
ओके. ये क्लिकिंग साउंड कभी आती थी मुंह खोलने बंद होने में जब मुंह खुलता था?
हाँ जी, वो पॉपिंग साउंड यहाँ पे सारी लाइक होती थी. पहले बहुत पॉप अप साउंड आती थी.
कितनी देर पहले?
1 year ago.
उसके बाद ठीक होगी अपने आप?
नहीं, मेरे को काफी मंथ्स रही है पॉप अप साउंड.
ओके.
और फिर बीच में अपना बंद हो गया. अब जैसे माउथ ओपनिंग नहीं होती तो पॉप साउंड नहीं आती. माउथ ओपनिंग नहीं, मेरे को काफी देर से लाइक ईयर हो गया, 6-7 month हो गए हैं कि मेरे को ओपनिंग नहीं होती. स्पाइनल कॉर्ड पे कभी थोड़ी बहुत पेन हो जाती है यहाँ पे.
लोअर बैक में?
हाँ जी.
ओके. गोलगप्पे खाए कितनी देर हो गई?
काफी देर हो गई. मैं गोलगप्पे भी क्रश करके खाने पानी में.
So after getting the treatment, she went to eat golgappas as well. I gave ozone injection, and after 5 minutes her review was.
ज़्यादा पेन नहीं हो रही. माउथ ओपनिंग 2 fingers कितनी हो गई अब?
करके दिखाना प्लीज.
Immediately after giving ozone injection, her mouth opening increased to 2 fingers.
यहाँ पे पेन अब लाइक खत्म हो गई, जो पहले बहुत हो रही थी, और यहाँ पे थोड़ी सी पेन लाइक हो रही है, कम हुई है काफी लाइक ज़्यादा.
Even young patients are getting so much problems these days. So this, I messaged her. You can see it was 3:23 p.m. and I greeted her with good morning. So she replied that she is not having any pain since then. I just gave one ozone injection and just corrected her bite a little bit, and she is pain free since then.
So the symptoms were.
So this is another 7-year follow-up of a patient whom I treated with basically her alignment and ozone as well. So basically she is from Noida, and she used to work for my digital post for my TMJ marketing. So for 3-4 months she didn't respond to me properly. So I asked her what is the problem basically. So then she told me that she is having many problems. She will explain in the video only. Then I asked her that you already have made so many slides for me on TMJ. You must read them properly, and your symptoms are related to them also.
So the symptoms were pretty hampering my life in a overall way. It was more like an alignment problem that I had, where I was falling to one side. I started having alignment concerns. I was falling to one side. I had this problem for almost like 6-7 months, and I went to a lot of neurosurgeons to get it checked. Even the MRIs they got done for me had nothing in it, so we were all like blank. What is happening? Right? Especially the spinning of my head, falling to one side, and almost not able to balance myself at times. Even when I woke up in the night, I was not able to stand properly, and I was falling and falling. And sometimes it went to that extreme levels where I was taken to a hospital to take in anxiety pills because I didn't know what was happening to me, right? And that caused a lot of anxiety in me. Except that I think I cannot remember anything more all those symptoms that have happened, because those were the past symptoms. And then we contacted Dr. Samir to check what is happening, and then he recommended a treatment plan in which he recommended ortho treatment, ozone therapy, and different other things. And after like almost 2017 to 2023, I'm having no blackouts like I was having in the past, no alignment issues, no head spinning. All the earlier problems which I was having, I haven't even faced that in my pregnancy, because I was thinking maybe in pregnancy all these problems could even uprise, but there was no issue that I faced even in my pregnancy. So almost 6 to 7 years down, I am still perfectly fine. And I am feeling comfortable even walking straight now, because earlier I was having like I was falling to right, sometimes falling to the left side, but now it is not happening with me, and I can walk straight. I feel healthy overall, especially with the ozone therapy. I think I lost some weight as well, almost around 3 to 4 kgs weight, which is a plus point for sure. And I think the overall treatment helped me get into a healthy body.
Basically, she used to travel from Noida to Jalandhar every month, because that time I used to correct the alignment with the help of braces. So she used to travel from Noida to Jalandhar every month. I think she traveled for around 1.5 years, and after that her treatment was completed, and she was pain free after that. She was not having any medications after I started the treatment only. So I think dentistry is really a game changer, and Dr. Maria already told that without dentistry, I think many problems, they are really unsolvable. So this is a muscle deprogrammer. This is me. Earlier I used to had headaches and cervical problems, and I thought that might be due to my work style, because as a dentist, every dentist is facing these problems of headaches and cervical pains. Even I used to take 1 or 2 painkillers every week. Then I learned about the functional dentistry, and I got my I was just finding what is a joke. Yes, मुझे competition मिल रहा है. So after that, after getting my teeth corrected, I never took any painkiller after that, and I am working even more than that before. Now I think question and answer section has come. जो भी आंसर करेगा उसको कल एक deprogrammer मिलेगा. With deprogrammer, basically what you will get to know कि आपके teeth के साथ what ailments, what problems are having in your body. You are having what problems you are having in your body. This is not a treatment. This is just for diagnosis. This is a muscle deprogrammer. Basically, this relaxes all of your muscles of the face and relaxes your joint. Pardon? Basically, this is a diagnostic thing. You have to wear while sleeping at night. Okay. क्वेश्चन कुछ नहीं, सबको ये तो बोला था कि सारे अटेंटिवली सुनेंगे. So modern dentistry is all about non-invasive and minimally invasive dentistry. Ozone therapy in present stage is reducing caries activity, involving periodontal health and many other things like TMJ as well. So ozone therapy is bound to revolutionize the way dentistry is going to be practiced in the future. So this is my contact. You can just this 94173, that is my personal contact, and you can contact me for different types of lectures and other things in your premises.
Bas ho gaya. Dr.
I
Samir, that was really good.
So I think if we can join hands together.
हाँ ये वाला चार्ज करते हो चला जाओ. Thank you, Dr. Samir. That was really nice.
Thank you.
So you, please, official. Thank you very much. Thank you.